Hello, my name is Juliana Posada. I am a nursing student at Bergen. I will be demonstrating or validating a sterile field and maintaining a wound. So I would have a doctor's order to come into my patient's room. Before coming into my patient's room, I will wash my hands. I will put some gloves on. I will then introduce myself to my patient, explain the procedure that I will be performing, and before doing anything at all, I will check my patient's ID band and make sure my patient does match the doctor's order. In this case, yep, my patient matches. I will then bring the bed up to a comfortable working position for me. I'm draping the area. Okay. I will then come over to the wound area. I will inspect the gauze. I will see if there's any odor that shouldn't be there, any pus, any infection signs, what kind of drainage is coming out. I will throw these out. I will then come and inspect the wound. I will measure it, the length, width, and the depth of it. I would measure the depth I can grab a Q-tip and put it to see how deep it goes. And I would say this is about 4 by 2 inch wound. I will then, so I inspected it. I will take my clean gloves off. Throw that out. I will now prepare my sterile field. So, grab this. I would probably wash my hands before doing this again. So I will open my field. Away from me, making sure it doesn't touch anything. Okay. I will grab this. Grab my gauze pads. I will then get my ABD pad, open it as well. I will grab my normal saline or sterile water, anything that's required in the doctor's order. I will check to make sure it is indeed what I need. In this case, it is normal saline. I will check. I will, if it's new, I would make sure I have the right order. If it's opened, I will see when was it first opened, the initial, and see the time it was opened. In this case, it's a new bottle, so I would just open it, make sure there isn't any particles inside or anything like that. So grab some like this, pour some in. I will then, like I said, I'll grab a little tape, initial it, write the date, today's date, and the time it was first opened. Okay. These, I didn't use these, so these can come over here. Okay, now we'll put my sterile gloves on. Coming through here. Make sure this doesn't touch anything, and it also doesn't touch the sterile field. I will then come from out here. Grab this. Have this over here. Okay, so I have my sterile gloves on. I will then, now that I have sterile gloves, always keep it above the waist. I never turn my back against it. But now that this is sterile and my gloves are sterile, I can now kind of play around with this, open the pad up if I want, and organize the gauzes together. Okay, so you know I inspected the wound already. I will dip this in the sterile water, drain it, and then make sure my gloves don't touch, and then I will come and pass it. I will come wipe the wound, throw it out. This is not sterile anymore, this is now clean. This hand still maintains sterile. Drain it, pass it over to the other hand. This corner, throw it out. Okay, now that I have cleaned my wound with a sterile technique, I will now, and it is completely clean, I will then grab this one with my sterile hand, pass it over, put it in. Okay, I will now grab my ABD pad with my sterile hand. My hands are no longer sterile, they are clean. But I have already finished with all of my sterile technique. So I can now come ahead. Well, let me just pour this out first. Okay, I will take my gloves. Gloves are garbage. I have my pad on. Face it. I will also, on a piece of tape, I will put my tape here on the table. I will initial the piece of tape. I will write today's date, and I will write the time that the wound was changed again. And once I write that, come over and place it right on the wound so that the next nurse can see when the wound was changed. Once this is done, I will cover my patient up again. Bring the bed to the lowest position possible. Bring the side rails up. I will also document, I will ask the patient how is he or she feeling in regard to the changing of the wound, any pain, did it get worse, has it gotten better, and I will also document how the patient tolerated the wound change and the consistency I saw, any signs of infection, the type of drainage, and like I said, the measurements of the wound. Okay, and then I will wash my hands and I am all done. Thank you.